to take the chair's prerogative here and spend a moment just giving you a real brief update on where we stand in the research world. And then our next speaker is going to pick it up from there and tell you about some very exciting advances. And so I know that many of you have seen this this slide in different forms, different ways over the years. This is basically a model that Dr. George Eisenbart at the Barbara Davis Center offered over 25 years ago of what happens as you progress from someone without diabetes to diabetes. And we know that type 1 diabetes occurs in families with genetic risk. Robin made a great case for that. That alone doesn't cause diabetes. We know it's a synergy with environmental triggers, and it's probably a series of triggers over years, months to years, where your beta cell mass starts to decline and you start to head towards diabetes. And by the time you're diagnosed, you have maybe 15 to 40% of that insulin-producing capacity remaining. So with this paradigm in mind, really you could come in at different stages to try and alter the course of diabetes. And Dr. Buckingham is going to talk some about what we're doing for people without functioning beta cells, how we can try and replace or mimic the beta cells. There's a lot of exciting studies that some of you have been a part of where we're taking people with recent onset diabetes and trying to preserve that functioning remnant. And then finally, we're trying to go upstream and screen and predict who might get diabetes and try and stop it from happening. And here today, I think all of us in the field would agree we've got a pretty good crystal ball. We can figure out where you are on this continuum. And so really the next step is, can we stop progression onto diabetes? And so the progress report I want to share with you is some trials at different stages as you move towards diabetes. And one very interesting study that's going on is called TRIGGER. The basic question is, if you avoid early cow's milk exposure, does that simple change in the dietary exposure alter your long-term risk for diabetes? And this study that involves over 2,000 infants, it turns out in an early pilot report from this trial that avoiding cow's milk in that first 6 to 12 months of life can lower your risk for diabetes by about 50%. So the results of this study, the fully powered study, are going to be available in 2017. I think this is a very powerful early finding. Now we can identify people, so that study was for people with a genetic risk, born into a family where someone has diabetes, but no activation of the immune system, no targeting of the pancreas as of yet. We can start to find people who have two antibodies floating around in their blood, one of which is against insulin. And in an earlier study, when we give them oral insulin, it seems to lower their risk for diabetes. And oral insulin, it wouldn't have any effects on metabolism, right? It's digested, the fragments are presented to your immune system, but it doesn't have the effects on lowering blood sugar. It just seems to alter your immune targeting of your pancreas. So in this preliminary study, this simple daily ingestion of an insulin pill lowered or delayed the onset of diabetes by 4 to 5 years. It's not a definitive cure, but to have something safe and effective that would be pretty amazing. So we're in the process now of repeating this on a larger scale. So people in this group, it turns out, have about a 25 to 50% risk for developing diabetes over the next 5 years. So a fairly high risk. We can keep coming down this risk continuum. We can identify people who have more than one antibody and whose beta cells are not functioning normally. Blood sugars are starting to go up, but they're not yet in the diabetes range. This group is even higher risk, so over 50% chance of developing diabetes in the next 5 years. In the past, we haven't really had any interventions to offer here, but within the past few months, we've launched a trial that Dr. Bluestone and I first proposed over 10 years ago. And the idea is to use something targeting the arm of the immune system that seems to cause diabetes, targeting the T cells, with a monoclonal antibody that Dr. Bluestone developed. This is a drug that's been used in new onset diabetes now in over 500 people that does a great job of preserving beta cells at that stage. So we're trying to take it one step upstream and see if it's a nice way, a safe and effective way to stop progression to diabetes. So this is a lead-in to get you to think about participating with us in the study TrialNet. And I suspect you've heard about this from us before. This is a screening study for first-degree relatives, ages 1 to 45 if you have an immediate family member with type 1, up to age 20 in the extended family. The screening test, it's a simple blood test. We basically run now a panel of 5 different antibodies. If you're under 18, you can repeat this yearly. If you're over 18 and test completely normally, the chances are you're never going to develop type 1, and we exclude you from this study. If, God forbid, you happen to have one or more antibodies, which can happen perhaps 4 to 5% of the time, then we invite you in for further monitoring and surveillance. And I think ultimately the question for you as families is why participate? And I think this is really one way that you can help partner with us in the clinical research world and help us advance the field. As a pediatrician, I think one of the definitive cures for diabetes is going to be if we can screen and prevent it. And this is a trial where we're learning more about what causes diabetes and ultimately how to stop it. So by participating in a study like this, you'll clarify what the risk might be for you or your children. The majority of the time, you're going to get a completely normal test result back, and you can breathe a sigh of relief. If you are at risk, it's very helpful to know. I think at the worst, if someone in your family moves on to diabetes, we'll know very early. 3/4 of the time, we make the diagnosis in these studies when someone's completely asymptomatic. And so people are not coming in the hospital, they don't have ketoacidosis. The sooner you start insulin, the safer it is, the longer the honeymoon's going to go. And then finally, you can think about participating in the prevention trials. I just want to call your attention to, okay, I lost a slide there. We do have one interesting study you can think about in trying to understand the immune process. We're basically trying to find people who seem to have longer honeymoons versus shorter honeymoons. So if you talk to us at our research table, our TrialNet table, we have a study to screen people ages 8 to 45 with type 1 and try and figure out why some people have longer honeymoons versus others and really better understand the honeymoon phase of diabetes. Now, for people with diabetes, we've really been trying to explore how to alter the natural progression. And not to give you too scary an introduction to immunology here, but this is the islets, the insulin-producing beta cells. For someone who's going to get diabetes, they're under attack by these activated cells of the immune system, the T cells, the T effector cells. And these cells get turned on and misdirected by interaction with a type of cell called an antigen-presenting cell. There's a very complex conversation that happens between these cell types. So the question has become, how can we alter this process? And the anti-CD3 antibody that I mentioned basically comes in right in here and alters that conversation. So, that's been a very promising avenue of research. It's a more targeted approach than global immune suppression, but we want to do better. And so the field has really exploded from here. And basically in red are therapies that we're considering now or are newer trials underway. And I know some of you in the audience are participating in some of these things. Here is the anti-CD3 approach and a variety of other approaches that are going on now. So this is a very exciting time, but it takes us time to get these answers. And I think ultimately the trials we're going to do are not just single agents, but we're probably going to need to combine agents that work in different ways to try and get some synergy and really get some definitive long-term safe and effective means to preserve beta cells. So that's the view from 10,000 feet from my perspective. This is the study I was mentioning about longer-term diabetes and in the honeymoon. So I'm going to shift gears now.